Canadian, and I've been under national health, and just this like talking about you have to have one foot in the grave before you do anything. My sister-in-law last year, she needed a new valve, but with 1 month she had the operation that had the valve in. Yeah, and I know another person that needed heart, I guess what do you call it, heart bypass, and she had it within 7 days. She had an attack down in Florida, flew home and had it within 7 days. So that's all BS what they say. You're going to have to wait years to have an operation. I think we need a national health program and take everybody in.
Well, the public option would do that.
Yeah? Okay. Yeah. Like in Canada, when they nationalized health, they took all the employees of Blue Cross and put them in the government program, and so they had all people trained to look after the health program.
My name is Joe Adams. I'm business manager at IBEW Citrus County UA. Every executive in this country and every industry has a contract with their companies, and these are the same executives that for some reason don't want employees to have a contract too. The Employee Free Choice Act will allow those employees to get a contract just like their boss. The Employee Free Choice Act is vitally important to the working class people. There's families struggling every day just to make ends meet. We don't want everyone to be in the union. We just want those employees who want to be in the union. Those are the people we want. Give them better living conditions and raise the prevailing wages in local communities such as this.
Hi, my name is Richard Dorff, previous healthcare lobbyist. I support this program. It's a very good program, and you need to read this material so that you'll support it as well. Thank you.
Hey, I'm Jennifer Kenny, Alliance for Retired Americans, Florida field organizer, and we're out here this morning in beautiful Crystal River, Florida, in front of a Bank of America. We came out here for a couple reasons this morning. First of all, Bank of America has come out against the Employee Free Choice Act, which, as we know, we need workers' rights protected, and we need a good Employee Free Choice Act legislation passed. And also, I'm out here this morning because we need to keep talking about health care, and the House has come out with a very nice bill. It supports public option. It also supports early retiree pay into Medicare, the 55 to 64-year-old early buy-in, and we are pro that as the Alliance for Retired Americans. And we're out here this morning just to give our message and let people know that healthcare is important. We have to have some meaningful healthcare reform in the United States, and the pharmaceutical companies and the insurance companies are just going to have to step aside and let a good public option come in and take care of American citizens. Right now there's about 47 million uninsured Americans, and we need to get those people insured, get them into adequate health care, and once people are healthy, that will eliminate a lot of other problems in this here United States. Well, what happens is there's the donut hall, which the new piece of House legislation is aiming to do away with. And when people fall into that donut hole, they are still paying their monthly premium in addition to paying full price for their medication. So what happens there, people can't afford to do both. So they either don't take their medication or they mess around with their dosage. They take half or a quarter or whatever it is they can afford to take as far as their medication goes. So then what happens is they're not as healthy as they need to be because they're not taking their meds. So when they come back out of the donut hole, which is the following calendar year, then they have to start all over again with doctor visits and medications and having their doses, brought back up to their levels where they need to be. It's a huge problem for our seniors.
Hi, my name is Deb DeVito. I'm a proud Democrat from Citrus County, Florida. We need health care, and we need it now. I'm one of the millions that got denied coverage for nothing more than a hospital visit to the emergency room. We can't even have any kind of dialogue once you get denied, and it's got to stop in this country. We can't afford what's going on, and we need help. Senator Nelson, Ginny Brown Waite, you guys got to wake up and smell the coffee. We need it now.